Coming up, a chance conversation at a small-town brewery turns into a life-changing decision when one man donates a kidney to a stranger and sparks a movement to save lives. Good morning, I'm Jessica Lovell, and we are live from the Dolph C. Simons Jr. Family Broadcast Studio at Olathe Hospital. Welcome to the Morning Medical Update. Before we get to our story today of generosity and courage, we're going to check in with Dr. Stephen Simpson back in our KCK studio for an update on the hantavirus that left 3 people dead and 8 others infected on a small cruise ship across the Atlantic Ocean. Here in the States, Americans who traveled on that cruise ship are being monitored. Dr. Simpson, you are a critical care specialist and a pulmonologist here at the health system. You are also a leading global authority on hantavirus and have treated patients. So help put this outbreak into perspective for us, if you would. We know that this strain is deadly, but how easily does it spread?
Well, in spite of what it might look like from all the news that we hear coming from the ship, it actually doesn't transmit all that easily. The data that we have on that suggests that in most cases it takes very close contact. The papers that have looked at this say things like kissing, things like sexual contact, or sometimes being just confined in a room with a person very closely for a while is enough to do that. And so in certain cases, in Argentina and Chile, healthcare workers have been at risk because they spend substantial time with patients. That was up until they understood that they needed to be using masks and so forth. But it doesn't transmit all that easily. Humans are not, in particular, a great host for any of these hantaviruses, and so it does happen. This is the only hantavirus that it happens for in the entire world, but it happens not all the time, not usually.
And Dr. Simpson, to your point, the CDC has said the risk to Americans, including us, is extremely low. So that is fair to say then.
That's absolutely fair to say that. For one thing, that hantavirus doesn't exist on our continent, North America. It would have to be coming in with an infected individual from South America, and we are closely monitoring what's happening with the folks on the ship, and that's highly unlikely to happen, except that certain places, such as the biocontainment ICU at Emory Hospital, are being prepared, which sits right next to the CDC, by the way, in Atlanta. That hospital is being prepared to handle any sick Americans that should happen to come from the ship.
And you've actually treated people with hantavirus in Argentina before in your career. How did that come to happen? And tell us, how do you treat hantavirus?
Yeah, well, let me clarify one thing. I didn't actually treat the folks in Argentina. The government of Argentina, understanding that I was, back in the 90s, I was the leading world expert on hantavirus pulmonary syndrome, helped to describe it amongst people in New Mexico. They called me, and they called my colleague, Brian Hella, who was the leading pathology virology expert in the world, and they said, we think we're having an outbreak of hantavirus down here, and we want you guys to come help us. And I think my principal function there was to advise their doctors and to reassure them that their doctors were indeed treating people appropriately and the way that would best assure good outcomes and the way that we had published that we should.
Well, Dr. Simpson, needless to say, you are certainly a trusted expert on the topic. I have one last question for you. The CDC is monitoring people who came into known contact with that infection. How long will that monitoring continue? Well,
it should take about 6 weeks. The longest incubation period that is recorded for human-to-human transmission this way has been 40 days. And so they will probably monitor. And when we say monitor, what actually is going to happen is they will have patients take their own temperature, pulse, respiratory rate, and so forth, and report in every day on that sort of information. And they will swoop in if people develop fevers or other symptoms of viral illness.
Well, you have been doing a lot of international news interviews the past 3 days, so thank you so much for talking with us here in Kansas City. We really appreciate your expertise, Dr. Simpson.
My pleasure. Thank you.
Thank you. Well, now it is time to meet the man and a woman, husband and wife, behind a movement that began with a random conversation with a stranger. We want to welcome Mark Scotch and his wife, Lynn. It is so great to have both of you with us today.
Thank you.
Very excited to hear about your story. Back in our KCK studio is nephrologist Dr. Jeff Klein and transplant coordinator Samantha Brenner. Dr. Klein, Samantha, great to have you.
Good morning.
Thank you.
So glad everybody could be here together just to talk about this remarkable story. Mark, I do want to start with you. Take us back to this chance meeting. You and Lynn are on vacation. You're sitting around at a brewery having some drinks and you meet some guy. Tell us how this all started.
Yeah, we had recently retired back in 2020 and we were on our way from Wisconsin to Texas. We just happened to stop into a brewery in Natchitoches, Louisiana. Got to talking to a guy there, kind of hit it off with him, giving each other a hard time about the Badgers and LSU and all that kind of stuff. And Lynn was there and we were just chatting with him, and then he kind of said, well, I got to get going. And I kind of gave him a hard time saying, hey, you want to hang out and have dinner with us? And he's like, no, I got to go. But he was just kind of hanging on, but he wasn't really leaving. And then he just come out and said, I got to go home and go on dialysis. And whoa. And he was on peritoneal dialysis, did it every night for 10 hours, 8 o'clock till 6 o'clock. And he said, I've got stage 5 renal failure. And he said, I'm kind of looking for a kidney. And I immediately thought about my sister-in-law who had donated 12 years previous. And I had never asked her one question about donation, never considered it for myself. But I knew she was healthy after donation. She had donated to a friend back in Wisconsin. And at the same instant, I thought about our little 15-month-old son that we had lost years earlier. And we had always regretted that we had never had the opportunity, to donate his organs. So when he said he was kind of looking for a kidney, it just, like a lightning bolt, I just said, well, I'll give you one of mine, thinking about these two things.
And you didn't even hesitate.
Not really, because I knew my sister-in-law was healthy, so hey, if she could do it, so could I.
Lynn, what are you thinking during this interaction? And what did you think of this stranger who's now quickly probably going to become a lifelong friend?
Well, I had the opportunity to be part of the conversation for the last 20 minutes or so, and there was just something about Hugh. He was so full of life, and you were just kind of drawn to him. And I was standing next to Mark when he said, I'll give you one of mine. And my head kind of swiveled, but I didn't say anything. It was his decision to make, and it just started from there.
So this also inspired you. Tell us about your donation story. This has all kind of come full circle, and this I call this a remarkable story because you've reached so many people in so many different ways. But how did you donate?
There's a full day evaluation process that takes place to be a living kidney donor, and I accompanied Mark when he went for his full day evaluation at our local transplant center. And I heard everything that he was hearing, and he was off at the end of the day getting some of the last medical tests, and I was just sitting in the exam room by myself thinking, I can't think of any good reason why I shouldn't pursue this for myself. Check into whether I would be eligible for donation. So we had to get his surgery scheduled because I would be his caregiver. But once we had that date on the calendar, then I started the ball rolling for myself. It happened to take me 2.5 years because COVID intervened twice. I actually went live on the registry that same year, and within a week, the transplant center had suspended voluntary surgeries, which this is. So that set me back, and then I contracted a mild case of COVID, and that sent me back. And then I was actually prepped to have surgery the next day in March of 21, March of 21. And they did one last blood test and discovered that my platelets had dropped quite drastically. Not enough to be of medical concern for myself, but because they are instrumental in clotting. And transplant centers are so protective of their potential donors that they said, we're just not going to do this right now. And the transplant center stuck with me for 18 months of monthly blood draws to monitor my platelet level. When they popped back up, they said, you're good to go. We'll do a few checkups to make sure everything is still medically A-okay. And I went back on the schedule, and by that time we had identified, through a mutual friend, we had learned of a little boy, 2 years old, in Minneapolis who needed a kidney rather desperately at that point. He had already had some leg fractures and things, had been on dialysis since he was 8 months old. And so I decided that I would donate on his behalf so that he could get a kidney.
Fantastic. And you said that the transplant team stuck with you for 18 months. I'm looking at you going, you stuck this out for all that time. You didn't even let COVID keep you from it. You could have bailed at any moment and said, maybe it's just not meant to be, but you were determined. I
was determined. It was important to me. And Mark mentioned our son who had passed away at 15 months, and there was just a lot of regret that we didn't have the opportunity, and this was just my way of kind of bringing that full circle.
We call this a chance meeting, but I think I said this felt very meant to be, as far as I see it.
Well, it almost wasn't, and that's you know a really important part of the story is if he would have turned around and walked out, we wouldn't be here today. So you've got to talk about it.
Got to talk about it, and that's what we're doing this morning. I want to bring in Dr. Klein, Dr. Jeff Klein. How often do you hear of a story like this where two strangers meet up randomly somewhere, and before you know it, it's a match?
Well, the story is certainly uncommon. These days, it seems like the social media match is a more common one where someone sees a post or knows a friend who made a post. But the theme rings true, that people are interested in donation. They just need to know the story, and they need to know that someone is in need. And most of us have that generosity of spirit that is just waiting for the moment.
That's so very true. Samantha, what is the first step for donors and recipients once they're matched?
Actually, there's a lot of steps before the matching. Like she said, contact the center. There's a lot of testing. We don't let people donate and do the surgery unless we find that, you know, they are medically able to live with a kidney for one kidney the rest of their life, and that it is not going to bring them any harm. So once they're matched and approved, then we either schedule a surgery, or in the case like an altruistic donor, we look for matches or put them in our national program, Kidney Paired Alliance.
What are some common questions, Samantha, that you get from donors?
Well, a lot of, like he said that he had never, asked his sister-in-law about this. So, it's a whole new thing. It's something that, people have never done and that they can only do once. So a lot of questions, how will it affect their health later in life? What will change for them? And really, it's just a small amount of time that things change while they are healing, and then they should return to their normal life.
Well, according to the National Kidney Foundation, more than 101,000 people are currently on the waiting list for a kidney. Only 17,000 people receive a kidney each year despite the overwhelming need. And each day, 12 people die from kidney disease waiting for that kidney. Dr. Klein, are we seeing more living donors? And how do movements like what we're talking about today help bring more awareness?
Well, we're slowly seeing an uptick in the rates of donation, both between waitlist kidneys, so deceased donors, and living donors, but it's been a slow climb. Awareness about either signing a donor card so that at the time that someone dies, they can donate to those in need, or ideally living donors so that they can, when healthy, donate a really good kidney to someone in need, are the ways that we create awareness around this issue.
Samantha, how does the coordination differ for someone who received a living donor as compared to a deceased donor when you're waiting on the list, or is it pretty much the same?
It's definitely different. When you're on the deceased list, you just have to, maintain your health, stay in touch with your pre-transplant coordinator. When you get a living donor, it is well planned. The surgery is a scheduled date, a scheduled time. It's all just a lot more organized. When people get a deceased donor, typically it's a call at 2 a.m. You know, and people are just like, what is happening? And, you know, they have to come into the hospital, and it's just, you never know when it's going to happen. So the planning definitely helps with the outcome of the living donor transplant.
Well, Mark, that chance encounter with Hugh that you had in that brewery, it really set your life in a different direction. What was the Oregon Trail, and tell us about Riding for Awareness?
Well, when I met Hugh, then I started to try to figure out, you know, how do I donate a kidney? He was living in Louisiana. He was registered at a transplant center in Shreveport. I called his coordinator the very next day and kind of got an overview, but I still kept searching. And I read the fact that, like you said, 12 people die every day waiting for a kidney transplant. I asked Lynn, I said, did you know this? And she goes, no. And it's like, my gosh, you know, how come we didn't know this? And I was always been a bike rider. I started riding bike pretty seriously late 90s, early 2000s. And whenever we do something, I try to figure out to get a bike ride in. So when I started hearing about going to Louisiana, I thought, maybe I can ride my bike down the Mississippi River and go to Louisiana, then donate a kidney. And so that ride was kind of working in my head. When I heard about 12 people dying every day, it just clicked in my head. Why don't I make like an awareness ride? And that started the ball rolling. I contacted the National Kidney Registry because for some reason I was on their website, sent them an email asking, hey, I want to create awareness about this need. Can you give me some ideas? And they connected me with an organization called the National Kidney Donation Organization. And that was started by a guy named Ned Brooks. And he was working with the NKR. And the NKR gave him my email, and he called me up. And the NKDO is a mentoring program. It's living kidney donors that help other living kidney donors, or potential living kidney donors, go through the process. So he had a lot of really good stuff, and he suggested, why don't I do my surgery in Madison, up in Wisconsin where I live, and then ride down to Louisiana after I donated? That would have more effect. And I said, well, I didn't know if I can do that. So then I had to learn about, can I really do that after I donate? So all these questions were there, and I belonged to a little mountain bike club, and I threw it out there, and one of my friends, actually from Kansas City, Lee Summit, he came up with the name Oregon Trail. And so I decided my kidney actually went to somebody in New York, and Hugh got a kidney from Southern California. So a guy from Wisconsin meets a guy in Louisiana, one kidney goes to New York, one kidney comes from California. Lynn donated, her kidney went to Illinois, and she gave a voucher to a little boy in Minneapolis. So I've ridden all those routes, and that's what the Oregon Trail is. It's the route of the kidneys.
It's really twofold. It's to show that you can do whatever you want to do physically after your donation. You can go back to whatever activity level you like, and it's also to raise awareness for the need, because we were just so shocked at the information Mark was finding when he started doing some research. We said, this is a solvable problem. If more people knew that they can do this, and it really has, we have never come across anything that has caused so little impact to yourself and so much impact to somebody else. You're saving somebody's life. And as Samantha said, you have a short recovery period and you're good to go.
I'm so glad you brought that up, because I do want to ask Dr. Klein about that. We're always trying to help people understand that it's safe. So is living donation the answer, to helping get people off the list, or reducing that 12 people who die every day? How do we help people better understand that it's safe to donate relatively?
Well, living donation is certainly our preferred method for getting people kidney transplants. These are elective surgeries in healthy people where we are able to do a full medical evaluation and ensure as best we can that person that donates can live as healthy and normal a life as they can with one kidney instead of two. The real advantage to living donation is that for a deceased donor, it's one donor, kidney goes to one recipient, and that's sort of the end of the story. Living donors now for large centers like the University of Kansas involve paired donations, where we have multiple centers involved, as were described here by Lynn and Mark, where we have multiple chains that are open and closed between multiple centers. This means that perhaps one person can't donate directly to the individual, but they can donate for that individual so that they get a kidney from somewhere else. These large chains are really how we get more and more people through to kidney transplants.
And Samantha, take us through those first few days for both the donor and the recipient post-surgery.
Well, day of surgery, the donor goes back to the OR. The kidney's taken out. The recipient is in an adjoining operating room. You know, kidney's taken over, put right in. It starts working automatically. The donor is in the hospital for 2 or 3 nights. Our recipients are 3 to 5 nights. Of course, you know, it's a surgery, so the donors do have some pain, you know, which we try to keep under control. But the next day, they're both up walking, you know, moving around. The recipient usually is feeling so much better. You know, they maybe didn't realize how terrible they were feeling until they got this transplant, and they realized how much of a difference it's made.
Well, Mark, you are a 2-time donor. Tell us about the second donation.
Well, when I learned about the need for kidney donors, I also, of course, learned about the need for liver donors as well. So I had asked my, you know, coordinator in Madison, Wisconsin about liver, but I was 64 at the time, and they had a hard cutoff at 60 years old. So I just kind of forgot about it, and I just wrongly assumed that that was kind of a national thing. And then on one of my Oregon Trail rides, I was riding from Southern California back to Louisiana. We had an event at one of the transplant centers at USC Keck, and one of their living coordinators was a biker, and I invite people to ride with me if they want to ride with me. So we had ridden from Santa Monica to the campus, and they were talking to him, and I was just on the side having a cup of coffee, and there was a nurse there, and I started talking with her, thanking her for coming down, and come to find out she was from the Living Liver program. And I said, oh yeah, I'm too old for that. And she goes, well, how old are you? And I was 66 at the time. And she goes, oh, well, you might qualify for our program. I go, what? So I kind of had to take my own advice. Like Samantha said, the first step is to get evaluated, and you can't even make a decision to donate until you're evaluated. It's kind of wasted effort. So I had to take my own advice, and I went back to, I did my Oregon Trail ride that winter, went back to Keck, got evaluated that fall, and they came in right at the end of my evaluation and said, sorry. Well, one of the doctors actually had met me on my ride, and so he asked me about the Oregon Trail, and he said, well, it's too bad you can't donate because of your structure of your liver. We can't safely take part of your liver, like a lobe. And so he kind of explained it all, and I was disappointed. I'm thinking, well, someone's going to die, you know. And then I was getting ready to leave. 10 minutes later, this other doctor came rushing in, and he said, wait, he said, you can donate. And I said, well, that's not what the last guy told me. And come to find out, they took my left lateral segment, just a sliver of my liver, like we call it, and it went into a 9-month-old little girl.
Wow. Wow. It's just the determination when I hear both of your stories of, like, I think just asking if you can do it and then being told no, I mean, that's a good ask. But the fact that you asked and asked again and just kept finding different avenues to make sure that you could, like you said, save that life because you said somebody was going to die. Lynn, what was your recovery like? Did you have any issues? We really want to educate people so they understand what the recovery process was like. How was yours?
I spent 2 nights in the hospital. They sent me home with only Tylenol. Because as Dr. Klein and Samantha probably well know, they have learned over the years that the fewer hard drugs you give, the faster you're going to recover. And that was all I needed, was the extra strength Tylenol. I took that for probably 8 or 9 days and just weaned off that. Our surgeries were laparoscopic. So there are just small incisions, and Other than a weight restriction of 10 pounds, which lasts for about 6 to 8 weeks, you can go back to your activities as you feel capable. If a person is still working and they have a desk job, they can no doubt get back to that job a lot quicker than if you were doing manual work. But recovery was very smooth.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is right there on your screen. Samantha, how does your care and communication help with this process as people are recovering?
Well, I'm kind of their go-to person every step of the way. You know, they meet Dr. Klein and they meet the surgeons, but they kind of go through me to get through everything. So always a lot of questions, especially right before the surgery. And, you know, donors are always like, oh my God, I'm so sorry, I have all these questions. Well, like I said, they've never done this before. So that's what I'm here for, is to answer all their questions.
So Mark, how has your body recovered? I mean, you've now donated twice. How are you feeling?
Well, 7 months after my kidney surgery is when I took my first Oregon Trail ride. I took off from Wisconsin, followed the Mississippi River, met Hugh. I was down a kidney, he was up a kidney. And first 4 days, I didn't really know. I had some friends riding with me. We got a little crazy, and first 4 days we did 100 miles a day on mountain bikes, going down to Louisiana. Felt pretty good with one kidney. I just tried to drink more water. I'm a little more cautious of that. The Oregon Trail I've been doing for 5 years now. I've covered a little over 10,000 miles on those rides. Of course, I ride my bike probably 3 to 4 times a week anyway, so I don't know how many miles, I don't keep track. But I'm finding it, you know, I don't notice it, to be quite honest.
I think you just answered my question very well with all of that bike riding. I mean, you're healthier than most. Yeah. Lynn, you're doing well?
Yes.
Love to hear this. Dr. Klein, as we've been talking all morning, we know that Mark and Lynn have dedicated their lives to encouraging living donations. What about deceased donations? If everyone checked that box, as you had mentioned earlier, on their driver's license, what kind of impact would that make?
Well, anything we can do to increase donation, both on the living donor side, to call centers like the University of Kansas to get more information and learn whether you could be a candidate. And similarly on the deceased donor side, signing those donor cards to make sure that if and when things happen, that you can help other people in need.
You have done about 250 interviews? Is this what I heard? How do you stay motivated?
We kind of quit counting.
I bet. What keeps you motivated day after day, ride after ride?
I think just the fact that you can have such a huge impact, like Lynn said. I mean, I can't think of anything else that we could do personally to make such an impact. We don't, you know, people give money, they give charity, they have all kinds of things, which is great, but on a grassroots level, this is such an impact. And just, we just talk to people and we hear their story, and that's quite enough to stay motivated.
I bet, I bet. Well, we want to get to some questions from our viewers this morning. Jeremy has one. He said, well, that's definitely a positive spin on meeting a stranger at a bar and losing a kidney. Don't hear that every day. How soon can someone get a new kidney? Do they need to have been on dialysis and been doing pretty rough for quite a while? Dr. Klein, I'll let you answer that.
You do not have to be on dialysis in order to receive a kidney transplant. You are required to have low enough kidney function to qualify. But besides that, ideally, we actually get people to transplant before they ever need dialysis.
Yeah, yeah. Well, we want to get our takeaways today. Dr. Klein, I'll stay with you. What do you want folks listening and watching to really take away from our program this morning?
Well, transplantation isn't possible without donors. So I thank the donors for all their generosity, both on the living donor side and in signing those donor cards to get people off the wait list. So if you're interested, call centers like the University of Kansas or whatever is in your area to find out more information about donation.
Samantha?
I'm just so lucky that my patients are people like Lynn and Mark that do this kind of thing. Thank you for spreading awareness about this so people might see this story and you know, maybe consider looking into it.
Samantha, I've said if I could do one job swap in the health system, it would be with your job.
It is pretty good.
It is a pretty good one. All right, so I just want to thank both of you for being here, donating, being the true hero that we all always call our donors. Lynn, what is the big takeaway from this story?
The big takeaway, I think, is if more people knew of the need and that they were able to donate, I think we could improve the numbers of people coming forward and get more people off the donor list, because in addition to the 12 to 13 that die every day waiting for a kidney transplant, you've got another 12 or 13 that die because they've gotten too sick to be on the transplant list any longer. So the impact can be huge. And unfortunately, not enough people who are signed up to be deceased donors die in such a way that their organs can be used, and that's creating some of the shortfall that we're seeing.
Mark, what's the big takeaway from your story?
I think mostly just talk about it. I mean, people that need a kidney, don't be afraid to just let people know, and people that are considering donation, just go get evaluated. You don't know until you get evaluated, then you can make a decision.
Well, thank you again for being here and doing all you do, sharing your story.
Thank you.
Thank you. Thank you to all of our guests for being with us today. Thanks to our viewers for joining us. We will see you back here on Monday.
It was something I've done 100 times, probably 1,000 times. And it just so happened that this one time broke and I was on the pool deck.
Coming up Monday, a fall from 22 feet and a recovery that's nothing short of remarkable. We'll take you inside Brock Martin's journey from trauma to surgery to walking back through the doors of the University of Kansas Health System.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.